All right, I'm Jasmine. Oh, you can't be laughing. This is gonna be a whole other behind the scenes. Hi, I'm Jasmine McGary, and I'm here with the Health Ed Club. And today we're really going to be focusing on the National Black Women's Maternal Health Week, which is observed between April 11th through the 17th. So today we actually have a special guest, Kyara Nichols. You can feel free to introduce yourself.
Hi, I'm Kyara. I'm a doula right now, and yeah, I went to Xavier University, Louisiana for my undergrad. I got my master's at Tulane in pharmacology, and I recently got my doula certification from Sister Midwife based in Louisiana, and then I got my herbology certification for postpartum and prenatal care from Sister Divine is Earth. She's also based in Louisiana.
Congrats, girl. All right. So, like we said, for today, we're talking about National Black Maternal Health Week, and some concerns that are out there, specifically from the CDC, is that Black women are 3 times more likely to die from pregnancy-related causes than white women. And they attribute this to health disparities such as lack of insurance, lack of information, lack of access to prenatal care, and even just simple information about what to do during pregnancy, during labor, postpartum. And so that's why we have Kyara here to talk with us a little bit later about a doula and what their role is during pregnancy. And some of the things I want to bring up is that we actually just recently received a new proclamation from the White House on April 8th, 2022, really just promoting what this week is about and bringing more awareness to the topic and providing solutions. And one solution that really stuck out to me was that the American Rescue Plan is going to provide a 12-month extension to postpartum coverage for women enrolled in the Medicaid and Children's Health Insurance Program. And for me, I just think this is really important. It provides an extra opportunity to seek treatment, especially when you have situations like postpartum preeclampsia, which can be fatal if not treated properly. So here, what is a doula and what is the role of a doula during pregnancy?
Okay, so essentially a doula is a birth coach, but the things that they do can vary based off of their training and based off of basically what they want to do. So there's a labor doula, labor and support doula, there's a postpartum doula, and then there's everything in between. And it's all based off of like what certifications you get essentially. Most doulas will be your advocate though. Like the main thing that a doula is your advocate. They'll teach you how to advocate for yourself. And if you do want to have like a hospital birth, they'll advocate for you to go according to what your birth plan is. If like, nurses or doctors or whoever try to disregard that. But overall, what they do is essentially up to you. You can have a labor and support doula, but not want that doula to be there for your labor, just for prenatals and helping you gain peace, calmness, and like courage to go through the birthing process. So.
And something you mentioned I felt like was important that I forgot to mention earlier was the need for more like patient advocacy. Because we hear a lot of times where like Black women feel unheard in like hospital or clinical settings, or they feel like they're not taken seriously enough, or their pain isn't real. So I'm glad you like brought that part up. So how involved are you like in like maybe a hospital room, for instance?
Great question. So I just recently attended my first hospital birth on Tuesday. And my client, she had pretty much every intervention except a C-section. So what I did before she got her epidural, so all the interventions are epidural, getting your water broken, and then getting Pitocin or getting your labor induced. So she got the Pitocin. She wasn't going fast enough and she was starting to feel some pain. So then she got her epidural. And then when her baby got about 5 centimeters, they said, hey, you want us to break your water? So she got her water broke. So I got to see all that stuff. I was more involved before she got the epidural, because when you get your epidural, your legs are numb. You can't move around as much. So when she was, pre epidural, I was like massaging her back. I was giving her words of encouragement, reminding her to breathe during her contractions, providing water, tea, making her laugh. I also brought like a birthing ball for her to bounce on until she got to that second stage of labor. But I did also want to mention one thing. Louisiana, as a whole, this state has the highest rate of maternal mortality in the entire nation.
I did not know that.
Yes. Where instead of being 3 times more likely to die during childbirth, Black women are 4 times more likely to die during childbirth in the state alone. So it's very, very interesting to see that this state, seeing the hospital birth. I was in a great hospital. I'm gonna give it up to the hospital I was at. They let her do whatever she wanted. She said she wanted, after the baby, she wanted immediate skin to skin, and she wanted the clamping, delayed cord clamping for the umbilical cord. And they stuck to those wishes. I did say they were a little pushy, but from what I've seen and what I've heard about other hospitals, they were pretty good. But yeah, that's why I just want to mention that.
So I guess, given that you say it is a little bit higher, the mortality rates for Black women in Louisiana specifically, what recommendations would you have for, say, like a public health official to try to address those concerns?
Yeah, I would say, like, so when I was doing my research, 52% of women who died during childbirth, it's like you said, after childbirth, after the postpartum phase, and it's up to 6 weeks after they give birth, or actually a whole year after they give birth. They don't do a checkup until 6 weeks after they give birth, which is not okay. As a doula, I do a 3-day visit, a 2-week visit, 6-week, 8-week visit, because after 2 weeks is when you can actually detect if someone's having like postpartum depression or anything like that. So I would recommend having, like they have the bill now, emphasis on postpartum care, making sure the mom is okay. She's not sleeping if she's breastfeeding. Baby wakes up every hour and a half to eat. She's not eating enough. In my herbology class, I learned that moms should not take full baths until 3 weeks after they give birth, because you're still open. When you give birth, it's a wound that's happening. You're ripping a placenta out. You're like taking a whole baby out. So you're essentially recovering, like as if you were recovering from a cold. When you have a cold, you don't take a full bath. You don't get your head wet. You eat soups, you eat hot stuff, just to give your body that nourishment. And nobody really focuses on that part when it comes to the healing. So I would say, providing some sort of information postpartum, not just sending them home and saying, good luck with your baby. Make sure that the latch is correct. Make sure that your baby's eating enough. Make sure that your baby's pooping enough. What about the mom? You know what I mean? Because a lot of women, especially Black women, don't have that support. And if you don't have support, you can't take care of yourself because you're taking care of your baby. I would also suggest teaching patients how to communicate with their doctors. Mm-hmm. I love the idea of triage. Usually, like in other places, they'll have a doctor, an advocate, and a patient, so that they can have a communication. And a 3-way dynamic allows for a better communication. So a patient can feel more comfortable asking their doctor questions that she wouldn't otherwise ask if, nobody was there. And that development of trust and that open conversation, that open dialogue allows the doctor to have empathy for their patients. And the one thing that Black women don't have is a lot of empathy because of implicit bias. You have a white male doctor, you can't relate to your Black female patient. And you're not going to want to because you're a doctor and you think you know better. It's just implicit bias. That's just psychology. It's not anything other than that. So really teaching people how to have those conversations and really teaching doctors how to have those conversations and learn about that implicit bias, kind of like, stopping it at the root. And then for, like you mentioned, Black people and lack of access to healthcare, developing programs to teach people how to do that. Like, I'm 26. I don't know how to get healthcare. You know what I mean? There's a lot of young people trying to have a baby and they don't even know how to file their taxes. How do they know how to get healthcare? You know what I mean? So I feel like hospitals should also have stuff like that as well, incorporated, if they want better outcomes, because they can't afford all these treatments. What if a mom needs a C-section and she can't afford it? Then she can't feed her baby. It's just, everything kind of just goes into each other.
They don't tell you how expensive it is just to give birth in the hospital.
Yeah.
I heard it was a piece for like thousands of dollars.
Exactly. Yeah. Don't get me started, girl. Don't get me started.
Okay. So I think those are like really good recommendations. Definitely, I can see a lot of evidence-based, like educational interventions being developed around that idea of maybe instituting like a mandatory follow appointment after birth, like you said, the
Yeah.
time increments. So not only are you a doula, but you also have your own company as a doula, Love for
Yeah.
Women. So give us a little bit of details, information about the services you provide, even beyond just caring for mothers.
Yeah. So a part of my herbology course was I learned how to make teas, tinctures, and ointments. Sorry. So essentially I make skincare healing products. It's not skincare products, it's healing products. I make salves for eczema. I make salves for like itchiness. I make oils to rub on your, like for women if they want to rub on their belly. I make ointments for like, breastfeeding because your nipples are so sore after you breastfeed. I make teas. I make yoni steams. The company is called Love Women, and that's what I'm doing. I'm teaching women how to love on themselves and providing services, providing products for them to be able to do that.
Do you have a favorite product?
Yes, I love my chamomile oil. So chamomile is a herb that helps reduce anxiety. It helps calm, like it helps you go to sleep. And the smell alone, it just it interacts with some receptor, but it makes you happy. I think it's dopamine, but it makes you happy. Like just smelling it just puts you in a great mood. So my favorite is my chamomile oil or chamomile salve. Either one is really good. And then I also really love my lavender oil. I put a little bit in my bath and I kind of like just melt. It's like the ultimate relaxation.
Okay.
Mm-hmm.
Oh, okay. Do you have a favorite moment as a doula?
As a doula, when the mom told her baby for the first time and she's like, oh my God, I just had a baby. It's like the cutest thing ever. Like the first thing both of my clients said was, he just came out of me. Oh my gosh. And just that realization that those 9 months of throwing up and pack pain and peeing every 30 minutes was actually worth it. You have a little bundle of joy. Yeah, that's my favorite part. I wanted to add or talk about the difference between like a home birth and a hospital birth.
Oh, let me sit up in my seat and take notes.
Yeah, so I follow a lot of like Black maternal advocates, Black midwives, Black doulas, Black birthing centers, and all of them are pushing for home births. And seeing the difference between a home birth and a hospital birth, I definitely agree, especially for Black women.
Mm-hmm.
The initiatives they're passing and trying to deny Black women of home births is actually causing that increase of Black maternal deaths, in my personal opinion, because Black women are dying in the hospitals. You know what I mean? Giving them the opportunity and the education about a home birth would actually, I feel like, help empower them, one, but also two, prevent all the stuff that's been causing them all the pain and everything like that. But yeah, I'm a huge advocate for just moms choosing what they want to do, even if it is getting an epidural, even if it is getting induced. You know what I mean? But yeah, I just wanted to touch on the home birth thing because it's so controversial for some reason. And I'm like, just let women do what they want to do. When my first client had her home birth, she went to the hospital and they immediately doped the kid up with vitamin K and put some antibiotic on him and gave him a shot. All these different things. She's like, I didn't want that. They were like, the only way we could see him is if you do all this, that, and the third.
They have their own policies they have to follow. And
yeah. And when I was in the hospital birth and I heard about why they have to do it, it's all fear-based. This could potentially happen if you don't do this. Whenever a doctor or a nurse says this could potentially, what's the percentage that happens in this hospital? What's the percentages that happen in the United States? Asking questions like that challenges nurses and doctors to really think critically and not just follow a protocol, because sometimes protocols don't work for everybody. You know what I mean? So, yes, so that is leading me into my next thing, is just advocating. I want to make sure that every mother, Black, white, Latino, Asian, advocate for yourselves. There are questions online, typing on Google, what question should I ask an OBGYN before they deliver my baby? I feel like every single mother should look that up and determine what you want for your birth. If you want a quick birth and you want to just forget about it, go ahead. Do your hospital birth. Don't even worry about it. But if you want a birth where you're present in the moment and you feel like you're connecting spiritually and you're a super spiritual person and you feel like you have a great support team and you can find a great midwife, or just do a natural birth, like with a free birth, go ahead, do your home birth, but don't let any statistics or potential this, that, and the third deter you from doing what you ultimately want to do. Because I've seen now that moms who end up getting the epidural, they always regret it because they feel like they didn't believe in themselves. And at some point, your body takes over that you won't even need it. It's just fear. Everything is fear. And with fear, stops that whole cycle of being able to push. So the main thing is just like releasing your fear, trusting your body, trusting yourself, and trusting that your baby is here for you to hold afterwards. The end.
Okay. Let's just give a round of applause. I need to see it. I need you to say thank you. So this is like really great. So excited. This is my first interview ever for the Health Ed Club. I'm glad I got to do it not only with a friend, but other Black women in healthcare out here doing her thing and trying to change lives, save lives. And just to do a really quick recap, the overall point of this is to spread health education, awareness, promotion, for doing things that make our lives healthier, increasing our health outcomes. And also just to add all links to information on the CDC from her campaign, which is all about promoting awareness for what to look out for, any warning signs for any complications. And also, I just want to shout out the Black Mamas Matter Alliance, which actually founded this observation week in 2018. And coincidentally, at the senator at the time, Kamala Harris, was the one who sort of spearheaded this to go through Congress and become what it is today. So yeah, shout out to more Black women. We're saving ourselves at this point.
No, seriously.
And that's okay, because we're going to make it work.
We are.
All right. So thank you.
Thank you.